Hey guys, so I just wanted to take you through the evaluation of the various care plans we did yesterday, and this regarding a GCS patient. So remember, the current evaluation is an oral presentation, takes about 10 minutes, and we are like to give a handover to somebody who will be taking care of a patient that you assessed, planned for their care, and implemented that care so that somebody can continue with the same. The handover takes the form of an SBAR technique where you will give a situation, background info, and give your assessment aspect and also do a recommendation. So for the patient yesterday was Joe Smith. So Joe Smith was admitted with head injury following a fall at home, and was diagnosed with subdural hematoma. He's having now CVA, and has impaired movement as well as issues with swallowing. And we had done a care plan yesterday revolving around confusion as well as pain and things of that kind. So while doing your evaluation, then you are supposed to capture all the details that relate to this patient. Now, this how such evaluation element would look like. So you will be presenting to the assessor. So I would recommend that you jot something to signify what you are going to present under situation, under background information, assessment, and recommendation. You need not to include everything, but at least you can have like something to guide you so that you don't off book, and also you don't forget anything that you really depend on. So in terms of situation, I can state that I am Vincent Obita, one of the staff nurses on the stroke unit, and I will give an end of shift report for Joe Smith, date of birth 01/01/1941, inside room 1. That one captures the situation at that moment. Then now from there you go to the background, and basically background you are going to capture what the patient was admitted with, what they have had done in terms of diagnosis, and also the social, economic, or maybe things of that kind in terms of history basically, and particularly past medical history and medication that they take. So in terms of this scenario, you would state Joe was admitted this morning with head injury and bruises on the arm and the face following a fall at home. He has had a past medical history of hypertension, a fall, and also left hip pain, because all these information were actually in the scenario you are given. Then you would say like he lives alone and has a dog at home. Is usually taking normal diet and is usually mobile and independent with activities of daily living. He wears glasses and hearing aid throughout. You can also state the hobby. So Joe likes reading, doing yoga, and also some jigsaws. And that captures like the background of this patient, majorly revolving their socioeconomic and also past medical history. Then you move towards assessment. So So under assessment, you're actually going to give what you've done since Joe came, and also any other activity or any plan of care that has been staged or executed since Joe came about. So you can talk of the observation. So you say under assessment, in terms of observation, Joe has a respiratory rate of 14, saturations of 96, blood pressure 136/72. You've got pulse rate of 69 and a tempo of 36.9. He has a Glasgow, since Joe is a neuro patient, or had confusion, you will state. Joe has a Glasgow Coma scale of 14/15, and is having subdural hematoma and has been confused and worried since he came in. You'd say since Joe has severe, might need some assistance with mobility as well as supervision with the meals because of one side weakness. As he is at risk of aspiration and also has impaired mobility. It is at that point you can also say he was experiencing headache and had painkiller given. That would cover your assessment and any other activity that you had done. Remember, if you under this assessment we've picked something under assessment as a skill, we've picked something under care plan, and we've done something about implementation. Now, the last bit of evaluation is recommendation. So you'd said under recommendation, I would recommend that any deviation of GCS to be escalated to the medical team immediately. Joe's Glasgow Coma scale need to be monitored every 30 minutes, and vital signs done maybe 2 hourly, as that would work for this situation, depending on how poorly you consider John to be. Then I would refer Joe to Joe ought to be referred to the SALT team to assess the swallowing and also help with the same, and also to refer Joe to the physiotherapy team to help with issues with mobility and things of that kind. That basically would capture evaluation for a neuro patient, and that presentation should be even shorter. Like mine is about 7 minutes, so you'd use like 2 or 3 minutes to jot down what you want to capture just in short form, then now do a full presentation within that period, and that should be okay to work for you. Thank you very much, and look out for any other videos that relates to the new Osce. If you have any concern or any scenario that you want us to cover online, just place your request on the comment section. Thank you so much, and have a nice evening. Bye.